Hello, everyone. Thank you again for coming. I'd like to introduce Dr. Chait, who is a physical therapist. I believe he's also licensed as an acupuncturist, and I can't remember what other credentials he has. He's a physical therapist with a couple of offices in Bergen County, and he has been gracious enough to come and talk to us about an integrated approach to the treatment of diabetic neuropathy and the management of painful diabetic neuropathy. So please welcome him. A lot of us have worked with him. He's treated many of our patients, including some of us. And so I'd like to give the floor to Evan. Thank you so much for joining us.
So whenever I present, I typically like to walk around. So hopefully it doesn't creep anybody out. First and foremost, I just want to say thank you to Jeff and Erica for planning this. You guys have spent so much time over the past few months putting this together, and your team. Jake, thank you. And before I really get started, there's one person in this room that what I love about this room is most of you guys are my friends. And I love looking out here and seeing people I've known for almost 2 decades. Right? We've known each other for 23 years. But interesting, 23 years ago, I started my first business. And I had one tool, and that was a manual therapy technique that I learned. And I remember when I opened up, it was a 600 square foot facility. And in the facility, I had no patients. It took me, I went to every doctor's office over and over and over again, all around Bergen County. Nobody referred me a patient. I'm like, listen, please, just send me your toughest case. This one woman gave me an opportunity. Elena Alpecos. She referred me my first patient. And that was, I think it was probably June of 2020. And I just want to say thank you. And because of her, I'm here today. Because without that one patient that I built trust, because I got lucky and helped that patient, I wouldn't be able to be here and be able to support my family. So I just want to say thank you. And it's full circle. And I'm blessed to be able to have the opportunity to share what has set our company apart. And there was a study done in our EMR about 2 years ago. They represent about 3,000 clinics. And in that study, what they were looking at is functional outcomes and length of stay, our clinic versus the industry standard. And fortunately, we fell into that 93 percentile. So not only do we get our patients back faster, but they're functioning faster as well. And I think it's because of the unique approach we have in our clinics. And my work is based on some Harvard-based researchers, and Dr. David Sinclair, I don't know if you guys know who he is, like Steve knows who he is, out of Harvard. He's the preeminent thought leader in anti-aging. And then another psychiatrist out of Harvard as well, and his work is, his name is Dr. Palmer, and both of their work is based on mitochondrial dysfunction. And so my presentation today is to shed maybe a little bit different of a perspective on the diabetic patient. And maybe if we start considering the patient from a different perspective of being a mitochondrial disorder, then we might have different treatments that we could use for our patients. And I think that's why I was invited here, to share some of those principles and concepts that we use in our clinic to be able to get results where other clinics don't. Cool? Who's ready for the journey? Do me a favor, everybody take out a sheet of paper.
I gave her a notebook.
All right? And I promise you I don't have vodka in here. So the rest of the presentation is going to go over mitochondrial dysfunction, its influence on diabetes, and then solutions around it. Cool? Cool. All right. And Peter Tia talks about this a lot. And the prevalence of diagnosed and projected diagnosed diabetes. Now, what's interesting in this graph, we all know that diabetes is climbing, right? This is not a new graph, but I just want you to pay attention to 1985-ish in this area. So pre-1985, all soda drinks used real sugar. From 1985 onwards, they've used high fructose corn syrup. There's a link here. Yep. And in fact, high fructose corn syrup disrupts mitochondrial respiration. I'll repeat that. High fructose corn syrup disrupts mitochondrial respiration. And look, over this period of time, every 10 years looks like the number triples, if I did my math right. So we could be mindful with our patients, right? Ask them what sodas are they drinking. Try to get them off. If they want soda, go with Mexican soda. Mexican soda is real sugar. All right, get them off of high fructose corn syrup. All right, that's it in the slide. But we see how the progression is happening over time. And this is very unfortunate. This data shows that of diabetic patients, type 2 diabetic patients, 73% of people 60 years old or older will get diabetic neuropathy. That's a huge problem. That's a matter. You guys see this, and you're in the thick of things every day with this. Right? But if we don't go upstream, how can we ever really serve these patients? Because then you're just chasing your tails. Then you're just treating wounds versus going up to the root cause behind it, right? So there's an ancient Chinese proverb: to treat disease, you must treat the root. All right, so if we're treating diabetic patients, we got to really educate them on nutrition and lifestyle. All right, and if we understand that it's more of a mitochondrial issue, then there's really cool things we could do. We could educate them. Now this graph I created, I love this picture. And basically the whole presentation would be built off of this. Because if we could understand that these ancient bacteria called mitochondria that are inside our cells, if we understand how they function and where they are predominantly, then we could actually have a course of action to fix it. All right, now, if you look at the mitochondria, there's a reason why there's specific mitochondrial density in certain parts of the body. For example, our muscles have about, every muscle cell has about 500 to 1,000 mitochondria in it. So does the pancreas and kidney, etc. But there's certain parts of the body that have more mitochondrial density than other parts. Guess what they are? Eyes, frontal lobe, and heart. It's pretty wild. And if you think about it, those are the areas of the body that are most metabolically active. Does your heart ever rest? No. Even when you're dreaming and sleeping, is your brain ever completely quiet? No. Right? And what's interesting is our retina has probably more mitochondrial density than any place else in the body. And the reason is this: mitochondria communicate via photons, and photons are nothing but light. So I don't know about you, last night I slept very poorly. Who in this room slept very poorly last night? Right? Did you sleep worse last night than in your normal rooms? I'm wondering if it was the fact that we slept poorly, or could it be there was too much light in our rooms? Because these same receptors that are in our eyes are actually in our skin. So you could have an eye mask on, which you had last night, but if you have light coming in from outside or light in the room, that's blue light, it's going to activate photosensitivity. It's going to mess up your circadian rhythms. All right. So in this graph here, in this picture graph, now look at this. We have the steroid hormone cascade. This is how hormones are produced. Who's ever heard of progesterone and testosterone and estrogen? Who wants more? What man in this room does not want more testosterone? Okay. All right. But we got to understand the mechanics behind it. If we have low T in men, or a dysregulation of progesterone and estrogen in women, we've got to go upstream. We're going to look at how those hormones are being manufactured. For example, we need enough cholesterol, but it's not coming from vegetable oils. The fat has to come from saturated fats. We need butter, lard, raw milk, lard, yuck. Butter is where I get most of my cholesterol from, and animal meat. But it has to be combined with retinol, or vitamin A. What's funny is this. We talked about the retina in the eyes, right? Retina, retinol. Relationship? I think so. So when we look at this, butter, cow liver, any kind of organ meat has enough retinol in it. So I would highly suggest, if you don't like eating liver, buy capsules. Or just eat more butter. plus thyroid hormone. Now, this is very interesting. One of my teachers, his name was Dr. Wilson. He actually created an ICD-10 code called Wilson's Temperature Syndrome. And what this syndrome dictates is this, that you can have a euthyroid, so a healthy thyroid, blood work shows normal, but you can actually have what's known as type 2 hyperthyroidism. Type 1 is diagnosed with blood work. Type 2 is diagnosed through body temperature. So during COVID, who had their body temperature checked? Everybody did. Everywhere you went, right? How many of you consistently fell below 97.6? Right? That's known as that's subclinical hypothyroidism. If the body temperature is below 97.6, and we did a small pilot study of my patients, and 80% of our patients they were on thyroid medications, but they still had low body temperature. And if we have low body temperature, what do you think is happening to blood flow to the periphery, especially to the feet? And so, Dr. Wilson's research was on the thyroid itself. And so we need to have the cofactors on the thyroid hormone, so we actually produce thyroid hormone. Now, it's very important to understand this. T4 levothyroxine is the most commonly prescribed medication for thyroid cases. But T4 does not increase metabolism. It changes the TSH levels. But T3 sets the metabolic blueprint of the body, as well as T2. Now, I'm a physical therapist and a doctor of acupuncture. I can't prescribe medications. I don't know if you guys could prescribe medications either, or you don't feel comfortable doing T3. That's out of our scope, right? But what we can do is recommend T2 to patients. T2 is a supplement. You can buy on Amazon. So I recommend patients going on T2 if their body temperature is below 97.6. And we're finding these great clinical outcomes. I get them eating a little bit more fat, get them on a little bit more butter, and now the mitochondria has the fuel to make pregnenolone. And downstream, pregnenolone makes progesterone, cortisol, aldosterone. So a lot of my patients are mineral deficient, specifically magnesium. And my question was, well, could it be the fact that up here, the macronutrients, they're not ingesting very well, so they're not able to produce enough aldosterone, they can't regulate the minerals? Calf cramping, very common, right? And then pregnenolone also makes DHEA, testosterone, and then it gets converted to estrogen. If we don't have these cofactors up here, then we're not going to be able to produce that cascade of hormones. Yeah, this is a diabetic neuropathy talk, but we have to talk about the foundations first. Because off of this, if we understand the mitochondria sets the pace for all hormones inside the body, and that's the baseline, then we can go into, okay, now how do we improve mitochondrial function, right? Now, who remembers the citric acid cycle? Remember that? The oxidative recycling system. Oxidative metabolism. So, over here, I don't know if you can read that, that says oxidative metabolism. Now, if we look at this, in order for us to make ATP from the mitochondria, we need oxygen plus glucose, weird, huh? Plus thyroid hormone. Oxygen is very copper dependent. So in order for oxygen to be made, we need proper amounts of copper. And most of us are not eating any organ meat, so we don't have enough copper in our diet. Number 2 is glucose. Now, we talk about glucose, and we have to be cautious of glucose with patients. But there's a difference between having smart carbs. Smart carbs are slow glycemic load carbs, like beans, lentils, root vegetables. Those are slow carbs. Versus high sugar carbs, simple sugars. Make sense? Brown rice, pasta, etc. And then it goes back to also the thyroid too. So interesting. The thyroid is needed, it's necessary to produce hormones as well as ATP in the body. So if you're tracking with me here, if we don't have oxygen plus glucose plus thyroid, we're actually going into what's known as anaerobic metabolism. It's going to decrease blood flow to different parts of the body. And this is the cascade where diabetes and diabetic neuropathy starts. Does that make sense? So then, from here on out, we're going to go over some studies that show why this is happening, how this is happening, and how to fix it. Who's cool with that? Who's coming with me? Jeremy Bryan, who's coming with me? All right, let's go. the process of mitochondrial biogenesis. So biogenesis just means how do we make more robust mitochondria, right? So how do we make them bigger, better, bolder, right? That's exactly what we want to know. And if you look here, I'll just read this for a second. Mitochondrial biogenesis is influenced by the environmental stress, such as exercise, caloric restriction, low temperature, so cold therapy, oxidative stress, cell division and renewal, and differentiation. Mitochondrial biogenesis is accompanied not only by variations in number, but also size and mass. And here is a couple of different ways, 3 different ways for us to actually increase mitochondrial biogenesis. When I say pharmacological intervention, what they're finding now is metformin actually induces mitochondrial biogenesis. That's one of the mechanisms why metformin works very well for diabetics. Exercise, love exercise, and then caloric restriction. What's funny is before I knew about this with my patients, I just got them exercising. I just worked on them, did manual therapy on them, I got them exercising, and most of them got better. I just thought it was blood flow, but what I was doing was actually increasing the mitochondrial biogenesis in my patients. So most people just need to move more, and maybe just eat a little bit less. All right, this is where the boring stuff happens for me, because I don't really like to read right from my PowerPoint. You can see I like to be more dynamic, but it's important for us to understand this. Mitochondrial dysfunction as a cause of diabetic neuropathy, mitochondrial stress, and pathogenesis of diabetic neuropathy. The next few studies will go into the science and the evidence behind mitochondrial dysfunction being a primary root of diabetes. And what's interesting, this pathway here, NAD+, dependent SIRT1 pathway, this is actually an anti-aging pathway. And so, who's ever heard of NADH or NAD? Right? So that activates, it's a molecule that activates the mitochondria. Right? There's 7 sirtuins. Sirtuins are anti-aging molecules that are governed by NADH in the body. And sirtuins are actually the anti-aging molecule. So when we activate that, we activate mitochondria. And here's an interesting study. And you guys, at the end, because I don't even know what time it is. What time is it? So I probably like 5 more minutes left.
10 minutes.
I still have 38 slides left. Do me a favor, if you guys, I have all the research studies here for my PowerPoint. If you guys, I'll leave these here when I leave. Feel free to take them, do what you want with them. If you have any questions, write down my cell phone now, just in case you guys have to run out. My cell phone number, guys, is 201-248-5854. 201-248-5854. And if you have any questions regarding the talk, just text me. If you have a patient that you want me to see, we get them in within 24 hours.
Repeat that cell phone.
201-248-5854. Would you guys want me to go into more of the therapies to help this and listen to the evidence of why this is happening? All right, good. All right, because this is the boring stuff for me. I love the research behind it, but all right. So this is how we increase the mitochondrial biogenesis, and there's many other ways. So this is just the framework that we use in our clinic. Nutrition and lifestyle. If we avoid high fructose corn syrup and vegetable oils, it's going to increase the function of the mitochondria. So 2 simple things you recommend to your patients. Get off of high fructose corn syrup and stop cooking with vegetable oils. Start cooking with butter, avocado oil, or coconut oil. I'll repeat that. Tell your patients to get off of high fructose corn syrup. Stop using vegetable oils to cook with. Start using butter, avocado oil, or coconut oil to cook with. Simple, easy. Psychoneuroimmunology. This is a big one. We're going to have a whole entire slide on that. We might do an exercise. Yes, sir.
What about olive oil? I'm sorry.
Olive oil is monounsaturated fat. When you heat it, it gets converted into an unsaturated fatty acid, and it creates oxidative stress in the mitochondria. So Italians would hate that. We should not be cooking, or even Greeks, we should not be cooking with olive oil. We could use olive oil on top of our foods after it's cooked, that's cool. But it causes reactive oxidative species in our mitochondria. Yeah. Thank you for asking. Psychoneuroimmunology, this is basically our thoughts causing disease. And 20 years ago, if a patient was told Or you go to a physician and like, oh, you know, I have pain everywhere. And doctor's like, oh, it's just in your head. Well, now they're finding 90% of most cases of chronic disease, even pain, is actually in the head. And because the brain changes. And this is the research in pain science with physical therapy. What we found with chronic pain, the brain changes. So there's deformation in the pain, and it's called cortical smudging. And so the pain, legit, with chronic issues, is actually in the brain. And it starts happening after 2 weeks of injury. In most of our cases, how many patients come to see us right after they get hurt? Yeah, like maybe 5%, unless it's an acute fracture or something like that, acute sprain. Right? But like there's plantar fasciitis and heel spurs, they've had their pain for months before they're like, I could do something about this, right? How long did I wait to see you for my foot? Right? So just be mindful that there's an aspect here that I'm going to dive in a little bit, and just be cognizant there is a whole entire mental, emotional, psychological component to chronic pain, and it's proven evidence by science, okay? Second thing is intermittent stress. So chronic stress, no bueno, which means no good in Spanish, by the way. Acute stress, cool. It's okay to have acute stress. You know, us moving from that room to this room, Jeff almost pooped his pants trying to get everything over, right? And Erica's panicking, like everyone's panicking. We're just like moving in, or like whatever, because it's not our thing, right? But acute stress is cool. Chronic stress, no good, all right? So how do we create intermittent stress? It's just like going to the gym and exercising. Like, you know how our muscles like to grow? Is a little bit of stress, right? But a lot of stress causes the muscles to break down, correct? You know what I'm saying? But intermittent stress, like intermittent fasting, good stressor. So I'm a nutritionist. I'm also an herbalist. I never start my patients with diet, ever. You know why? It's behavior. It's habits. They have these habits, and these habits are they're not from this age. They're from 0 to 7 years old. So from 0 to 7 years old, we're in a brainwave state called theta. Theta brainwave is hypnosis. So whatever happens to that child between the ages of 0 and 7 years old was pre-programmed by our parents, or our grandparents, or society at that time. And so, we're taught how to eat, move, and think by the time we're 7 years old. Yeah, we could reprogram ourselves, but we need to be aware that that 0 to 7 years old is really important for us in our subconscious brain. So intermittent fasting is important. High intensity training. Now this is different than high intensity interval training. In other words, this. In our clinic, I don't care how old you are. I don't care if you're a 16-year-old athlete or a 95-year-old that can't walk. I'm making you exercise till you sweat and fatigue. I want muscle fatigue in every patient walks in the door. I don't care how old you are. And the reason why is this: I want to increase mitochondria. And I want to put stress on the body. I don't care. High intensity interval training, also known as burst training. And then I make cases that come in after they do their strength training, I have them go on a bike or elliptical, and I push them really hard. As hard as they could tolerate, right? Really hard for me is different than a 95-year-old. But I think most PT clinics, they just put them on a hot pad, cold pad, ultrasound. These people, if they fall and break their hip, they're dead. All right, so it's my job and my clinician's job to make sure this person, if they fall, they have the bone density to support. And the only way to make that happen is through strength training. That's it. So I don't care how old you are, you need to move. And we get you moving. That's it. We're not afraid to move our patients. And then something known as photobiomodulation. Is Erica here? She had to step out. Okay, did you see it with the red light therapy that was on her? All right, that's what we use in our clinic. Almost every patient gets light therapy. Now the question I often get is this, guys. What's the difference between red light therapy, LEDs, versus laser? And who gets that? Who's ever thought of that question before? That's a common question I have. Because we have doctors always contact us to do class 4 laser. And class 4 laser we do not have. But we have LEDs. Now the difference is this: they have the same clinical outcome. The difference is this: laser works much faster, because the dosing is very pinpoint. So in a 3-minute period of time, it's going to take us 15-20 minutes with an LED light. But the thing is this: the cost difference is between $35,000 to $100,000 for class 4 lasers versus an LED light a patient could buy for like a few $100. They can do it at home. But dosing is dosing. You just have to do it longer. And so you'll see some pictures of us doing an LED later. And then pulse electromagnetic field technology. Who remembers back in the day, it was probably maybe a decade ago, right, Steve, that bone stimulators were like the in thing. I forget when that was. Do you guys still do bone stimulators, or is that less prominent now? You still do. So the PMF device, that's a bone stimulator, pretty much. Now, what we've been able to do is find technology that does the same thing, but in a group setting. So we have something known as a Tesla coil in our clinic. We've got 5 or 6 people around it, and it spits out 700,000 volts of electricity every second, and it's pulsed. So it's a pulse electromagnetic field device that doesn't have to be connected to patients. And then, better yet, this is my prototype. I created a portable unit that does the same thing. It's still in the early stages. It's my prototype. We've been using this clinically for about 4 or 5 months, and it's based on Tesla technology as well. It's called a rodent coil, and it's an infinite quarter coil based on what's known as vortex-based math. And this is powered by an amplifier. And this one is I call it the double donut. It goes about 15 feet in radius. So I could have this on right now and it's gonna affect 15 feet out. So it's pretty cool technology. How much time do we have? I have to wrap it up. I didn't even get through any of my PowerPoints. Cold exposure, very important. So this morning I was not feeling well. I was low fatigue. I put my shower on cold for the last 60 seconds of my shower just to optimize mitochondria and improve brain function. Heat shock therapy, hot packs, infrared saunas. Really good for optimizing mitochondria. Peptide therapy, actually skip over that, I'll come back to that in a second. We talked about thyroid optimization and lymphatic drainage. Now there's a direct link between thyroid and lymphatics. Who's ever heard of myxedema with thyroid patients, right? Or hypothyroid patients. That's nothing but a lymphatic issue. So if we see chronic pain, it could actually be upstream, it could be a thyroid issue. And so we've been able to help a lot of our patients that have chronic pain just by getting them on T2, that's a supplement. T2 you can buy on Amazon. And their pain got better. And then sleep. Sleep is one of the most important things. I mean, that's just a 3-day workshop I can do on sleep. All right? But sleep is really important. Make sure your patients are focusing. If they wake up between 2 and 4, who in this room wakes up between 2 and 4 a.m. on a regular basis? That's a blood sugar dysregulation issue. So your blood sugar is taking a dump around 2 to 4 a.m. So your body goes into a fight or flight response. Then the liver starts dumping glucose, called gluconeogenesis, just to stabilize your blood sugar. And then it wakes you up. It creates adrenaline, that's why you wake up. So just be mindful. I would either take berberine, it's a supplement that you could buy, or metformin before you go to bed. That we've seen help a lot of patients that wake up between 2 and 4 a.m. The dosing for berberine is about 1.5 grams. It can upset the stomach. It's a Chinese herb. It's really good for the gut microbiome as well. But if you take a lot of it at the same time, it could upset the stomach. But I think it upset the stomach because it's regulating the microbiome of the gut. Same thing happens with metformin. That nausea or upset stomach could also be the fact that it's regulating the microbiome. Can I make one last comment? One last thing. If you guys can, start researching peptide therapy. Start researching, if you haven't heard of it, start researching it. You guys can write prescriptions for it. It's novel medicine. It's from Russia, about 40 years of research going back to the Cold War. It's an interesting story with Dr. Kavinson, the founder of peptide therapy. He basically had a gun to his head during the Cold War because the Russian astronauts and the submariners, they were dying early because of radiation poisoning. And so he had a gun to his head. He said, listen, if you don't find a solution for this, you're dead, pretty much. And so he was given close to like $1 billion in today's money to create a solution to rehab this problem. And so he created peptides. And peptides are basically molecules. They're amino acids, but the small chain amino acids of 5 to 50 amino acid pairs. Really, really, really tiny amino acids. So very little side effects, if any side effects with these. All there is amino acids. But they're targeted to specific organs. So there's a pineal gland peptide called epitalin. That one targets sleep-wake cycles. And sleep-wake cycles are extremely important for your diabetic patients. There's another one called Pancreagen. That one's for the pancreas. It rehabs the pancreas. And another one called Thymogen. Do your research on this. Again, you guys have my cell phone. Just touch me. Yes, sir.
Does intermittent fasting have a negative effect on sleep optimization?
Maybe.
If you're not eating, for that.
Maybe. It depends if you're fat adapted or fast adapted. Like for me, it doesn't affect me now, but I've also been doing this for almost a decade.
Yeah, I do it. Intermittent fasting. I'm waking up at 4.
Yeah,
So
and it could. And how long is your fast, if you don't mind me asking?
18 hours.
All right, go up to 24 and see what happens.
Wait.
Yeah, go up to 24. So the research on autophagy is the ability for the body to self-repair. The research on autophagy for women is a 16 to 18 hour fast. So in order for us to turn on the anti-aging genes, women need to fast at least 16 to 18 hours, alternating days. I would never do both. I would never do days back to back. Now here's the caveat. Fasting suppresses metabolism because the body wants to slow down to protect itself. So if you suppress metabolism, the thyroid's going to become jacked up. And that's what happened to me. I became a vegetarian about a decade ago. Maybe 12 years ago. My body temperature dropped to 94.5. And so I found T2 thyroid. My body temperature did not climb. So just be mindful. If somebody goes on fasting, they need to be monitored by body temperature. Body temperature. What question do you have? Guys, I'm sorry. I only got through 3 slides. I have 35 more.
Thank you very much.
And if you guys have any questions, text me.